10 signs you have an iron deficiency. Did you know that iron insufficiency is the world's most frequent nutritional disorder? Your body requires an adequate supply of iron to generate hemoglobin, the blood component responsible for delivering oxygen to all regions of the body. Anemia is a condition that occurs when there is an iron deficiency. There is a significant lack of understanding concerning iron deficiency. As a result, many people are naive to the signs and symptoms of iron deficiency in the body. Furthermore, because the symptoms are not particularly concerning, minor cases may go undiagnosed. In today's video, we'll go over the signs and symptoms that may indicate you have an iron deficiency. From fatigue to hair loss to cold hands and feet to shortness of breath and other symptoms. Keep watching until the end to learn about them all. Fatigue. If you are constantly weary, even after adequate rest, you may be anemic. This is the most prevalent sign of iron deficiency, yet it is also one of the most difficult to identify. We are so used to our hectic lifestyles and feeling exhausted that we overlook weariness as a normal part of life. However, iron shortage causes less oxygen to enter your tissues, depriving your body of the energy it requires. If your regular exhaustion is accompanied by feelings of weakness, irritability, or inability to focus, iron, or a lack thereof may be to blame. After all, those with iron deficiency who develop to anemia are said to have fatigued blood. Infections that occur frequently, because iron is essential for a healthy immune system. Low levels of the mineral can leave you more susceptible to illnesses. Red blood cells aid in the transport of oxygen to the spleen, which is one of the organs where infections can be battled. The spleen cannot operate effectively if there is insufficient oxygen. Red blood cells also transport oxygen to lymph nodes, which contain infection-fighting white blood cells. When you are iron deficient, your white blood cells do not generate as they should. You may become weak as a result of not obtaining enough oxygen, making you more prone to diseases. Pale skin. Another common indicator of iron insufficiency is light skin and pale pigmentation of the interior of the lower eyelids. Because hemoglobin in red blood cells is responsible for the red hue of blood, low levels during iron deficiency cause your blood to be less red. As a result, if you are iron deficient, your skin may lose its healthy, pink tone. Paleness can affect the entire body or just one area, such as the face, gums, inside of the lips, lower eyelids, and even your nails. This is frequently one of the first signs of iron insufficiency that doctors look for. Paleness is more typical in moderate to severe anemia situations. When you pull down your lower eyelid, the interior layer should be a bright red color. If it is a very pale pink or yellow color, you may have an iron deficit. Chewing ice. While this may appear weird, an extreme appetite for ice is another indicator of iron insufficiency. This illness, known as pagophagia, is a type of pecan eating disorder in which patients consume non-nutritional substances. Every day, those suffering from pagophagia consume several cups or pounds of ice. According to one study, eating ice may provide an energy boost to people who are iron deficient. Hair loss. Iron deficiency, particularly when it progresses to anemia, could result in hair loss. When hair follicles do not receive enough oxygen, they enter a resting state, and hair falls out and does not regrow until anemia is corrected. It is typical to lose roughly 100 hair strands per day. However, if you observe that your hair is falling out and not growing back, this could be an indication of iron deficiency. Women's heavy periods. 2 heavy periods are the leading cause of iron insufficiency in women. They lose a lot of blood, replace roughly half of it, and then lose a lot more the next month. It's like filling up a car with a short tank of gas. Each month, your period should only take up 2 to 3 tablespoons. To see if you're losing too much blood, use this tampon test. If you need to replace your tampon more frequently than every 2 hours, you should see your gynecologist. Breathing problems. Hemoglobin allows red blood cells to transport oxygen throughout the body. When your body's hemoglobin levels are low due to iron deficiency, your oxygen levels will be low as well. This means that your muscles will not receive enough oxygen to perform everyday activities like walking. While a result, as your body attempts to obtain more oxygen, your breathing rate will increase. As a result, shortness of breath is a common symptom of iron insufficiency. Iron deficiency may be default if you find yourself out of breath when performing routine everyday chores such as walking, climbing stairs, or working out. Heart palpitations. Another symptom of iron deficiency anemia is noticeable heartbeats, often known as heart palpitations. Hemoglobin is a protein found in red blood cells that aids in the delivery of oxygen throughout the body. Low hemoglobin levels in iron deficiency indicate that your heart has to work harder to transport oxygen. This might cause irregular heartbeats or the sensation that your heart is pounding too quickly. It can cause an enlarged heart, a heart murmur, or even heart failure in severe situations. These symptoms, however, are much less prevalent. To experience them, you would have to be iron deficient for a long time. Cold hands and feet. If your fingers and toes are frequently cold, you may be iron deficient. When you don't receive enough iron, your body's blood oxygenation decreases. As a result, it redirects blood away from your extremities and into more vital organs such as your brain, heart, kidneys, liver, and lungs. Because there is less blood flow to your fingers and toes, they will feel colder. Restless leg syndrome, RLS. Iron deficiency has been associated to RLS. Restless leg syndrome is characterized by a persistent desire to move your legs while lying down. It can also create unusual crawling or itching sensations in the feet and legs. It is frequently worse at night. Thus, sufferers may have difficulty sleeping. The reasons of restless leg syndrome are still unknown. However, iron deficiency anemia is known to affect up to 25% of patients with restless leg syndrome, and the lower the iron levels, the worse the symptoms. So, what causes iron deficiency? Now that you're aware of all the symptoms of iron deficiency, let's talk about why they occur in the first place. Poor nutrition. Iron-deficient diets are a major cause of iron insufficiency. Iron-rich foods, such as eggs and meat, provide your body with much of the iron it requires to manufacture hemoglobin. An iron deficit can develop if you do not consume enough iron through your diet to sustain your iron supply. Iron is predominantly present in the blood, where it is kept in red blood cells. If you lose a lot of blood due to an injury, childbirth, or heavy menstruation, you may develop an iron shortage. Slow blood loss from chronic conditions or some cancers can also cause iron shortage in some people. Reduce iron absorption. Some people are unable to absorb enough iron from their diet. This could be due to a small intestinal problem caused by disorders such as celiac disease or Crohn's disease, or if a section of the small intestine has been removed. Pregnancy. Iron deficiency is a typical concern for pregnant women. The developing fetus requires a lot of iron, which might result in iron deficiency. In addition, a pregnant woman's blood volume increases. More iron is required to meet the needs of this increased amount of blood. Is it possible to avoid iron deficiency? Yes, there are preventative measures you may take to avoid iron deficiency. Treat the source of the blood loss. Consult your doctor if you have heavy menstrual cycles or digestive issues, such as frequent diarrhea or blood in your stool. Consume iron-rich meals. Iron-rich foods include lean meat and poultry, dark, leafy greens, and legumes. Consume foods that assist your body absorb iron, such as orange juice, strawberries, broccoli, and other vitamin C-rich fruits and vegetables. Make nutritious dietary choices. Most people who eat a healthy, balanced diet obtain the iron and vitamins they need from their food. Coffee and tea should not be consumed with meals. These beverages make it more difficult for your body to absorb iron. If you take calcium supplements, consult your doctor. Calcium can make iron absorption more difficult. If you have trouble getting enough iron, consult your doctor about the best approach to acquire enough calcium as well. Please share your thoughts in the comments box below.